I'm here because of my own mother's story. She died of cancer, and in the last 6 months of her life, she was on the phone in her hospital room arguing with insurance companies instead of focusing on getting well and spending time with her family. I'm here because of the millions who are denied coverage because of pre-existing conditions or dropped from coverage when they get sick. I'm here because of the small businesses who are forced to choose between health care and hiring. I'm here because of the seniors unable to afford the prescriptions that they need. I'm here because of the folks seeing their premiums go up 20 and 30 and 40 and 50 and 60% in a year. Ohio, I am here because that is not the America I believe in. That's not the America that you believe in. So when you hear people say, start over, I want you to think about Natoma. When you hear people saying that this isn't the right time, you think about what she's going through. When you hear people talk about, well, what does this mean for the Democrats? What does this mean for the Republicans? I don't know how the polls are doing. When you hear people more worried about the politics of it than what's right and what's wrong, I want you to think about Natoma and the millions of people all across this country who are looking for some help and looking for some relief. That's why we need health insurance reform right now. You know, part of what makes this issue difficult is most of us do have health insurance. We still do. And so we kind of feel like, well, I don't know, it's kind of working for me. I'm not worrying too much. But what we have to understand is that what's happened in Natoma, there, but for the grace of God, go any one of us. Anybody here, if you lost your job right now, and after the Cobra ran out, looks like we got somebody who might have fainted down there, so if we've got a medic. No, hold on. I'm talking about there's somebody who might have fainted right down here. So if we can get a medic just back here. They're probably okay. Just give her or him some space. So let's just think about if you lost your job right now. How many people here might have had a pre-existing condition that would mean it'd be very hard to get health insurance on the individual market? Think about if you wanted to change jobs. Think about if you wanted to start your own business, but you suddenly had to give up your health insurance on your job. Think about what happens if a child of yours, heaven forbid, got diagnosed with something that made it hard for them to insure. For so many people, it may not be a problem right now, but it's going to be a problem later. At any point, and even if you've got good health insurance, what's happening to your premiums? What's happening to your co-payments? What's happening to your deductibles? They're all going up. That's money straight out of your pocket. So the bottom line is this. The status quo on health care is simply unsustainable. We can't have a system that works better for the insurance companies than it does for the American people. And we know what will happen if we fail to act. We know that our government will be plunged deeper into debt. We know that millions more people will lose their coverage. We know that rising costs will saddle millions more families with unaffordable expenses, and a lot of small businesses are just going to drop their coverage altogether. That's already what's been happening. A study came out just yesterday. This is a nonpartisan study. It's found that without reform, premiums could more than double for individuals and families over the next decade. Family policies could go to an average of $25,000 or more. Can you afford that? No. You think your employer can afford that? No. Your employer can't sustain that. So what's going to happen is they're basically, more and more of them are just going to say, you know what? You're on your own on this. We have debated this issue now for more than a year. Every proposal's been put on the table. Every argument has been made. I know a lot of people view this as a partisan issue, but look, the fact is, both parties have a lot of areas where we agree. It's just politics are getting in the way of actually getting it done. Somebody asked, what's our plan? Let me describe exactly what we're doing. Because we've ended up with a proposal that incorporates the best ideas from Democrats and Republicans, even though Republicans don't give us any credit. That's all right. You know, if you think about the debate around health care reform, there were some who wanted to scrap the system of private insurance and replace it with government-run care. And look, that works in a number of places, but I did not see that being practical to get help right away for people who really need it. And on the other end of the spectrum, and this is what a lot of the Republicans are saying right now, there are those who simply believe that the answer is to unleash the insurance industry, to deregulate them further, provide them less oversight and fewer rules. This is called the Fox Garden, the hen house approach to health insurance reform. So what it would do is it'd give insurance companies more leeway to raise premiums, more leeway to deny care. It would segment the market further. It would be good if you were rich and healthy. You'd save money. But if you're an ordinary person, if you get older, if you get a little sicker, you'd be paying more. Now, I don't believe we should give the government or insurance companies more control over health care in America. I believe it's time to give you, the American people, more control over your own health insurance. And that's what our proposal does. Our proposal builds on the current system, where most Americans get their health insurance from their employer. So if you like your plan, you can keep your plan. If you like your doctor, you can keep your doctor. I don't want to interfere with people's relationships between them and their doctors. Essentially, here's what my proposal would change. 3 things about the current healthcare system, but 3 important things. Number 1, it would end the worst practices of the insurance companies. All right? This is like a patient's bill of rights on steroids. Within the first year of signing health care reform, thousands of uninsured Americans with pre-existing conditions will be able to purchase health insurance for the first time in their lives or the first time since they got sick. This year, insurance companies will be banned forever from denying coverage to children with pre-existing conditions, so parents can have a little bit of security. This year, under this legislation, insurance companies will be banned from dropping your coverage when you get sick. Those practices would end.